House with Aesthetic TV, and I'm in Beverly Hills talking with Dr. Ziering about hair restoration.
Good morning. How are you?
I'm good. How are you?
I'm great. What we do here is try to make everybody have a good hair day.
I love it. So what do you actually do? So a guy comes in and he is losing his hair, and how do you take care of him?
You know, it's interesting. You put it through, but it was, very noticeable.
Right.
Then what happened is we took a strip of tissue from the back of the head and then used a microscope to dissect them one at a time into follicular units, which is how they naturally grow, 1, 2, 3 haired units.
Okay.
The negative to that was that people sometimes would get a linear scar in the back of their head. And so that limited the options for wearing very short hair.
Right.
So in today, with many people wanting to wear their hair short, but not wanting a linear scar, we had to figure out a different way to do it. So we started doing what we called the follicular unit extraction, where you take them one unit at a time from the back. We did it by hand, or we did it with a motorized engine, but as you can imagine,
Forever.
yeah, very time consuming, very draining on the physician as well.
Yeah.
And that's just the harvesting part. So if you're doing that one day, as the doctor, you're fatigued before you even get to do the design, which is the most significant area. So after the labor-intensive and time-consuming process of doing it by hand, Restoration Robotics came up with this device. This is the ARTAS robotic system. We call her Satra, if you look at it backwards.
We call her, so she's a woman.
Yeah, well, most of our patients are men with this, so they like,
They like the woman's touch.
Yeah, who can blame them? So it's definitely more gentle that way. But what this piece of equipment is fascinating, the technology, because it combines not only the latest computer technology, it also combines lasers and photographic camera technology along with it. And precise, unbelievable precision, we're able to remove the grafts one at a time, and we can do this again and again consistently.
Okay.
And get the best possible results for the patient.
So how many hair follicles are you taking out from the back of the head?
Well, we can take up to 3,500, 3,600 follicular units from the back of the head in one sitting if the patient has the appropriate density in the donor area.
Okay.
And what we do a little different is instead of taking 2 days to do that procedure, we have the patient come in the afternoon before and we make the incision sites where the grafts are going to go in the balding or thinning areas, and that actually stimulates the tissue to get ready to receive the graft. They come in the next morning, and then we're able to harvest as many grafts as we need to do that. And that's what our patient that you're going to meet later on today will show you we're going to do. We've already made the incision sites, and we're going to harvest those grafts.
Now, what about scarring?
So there's no linear scar with this because it skips around. So we take about 15% or less of a given zone. We use a much larger area to do that, and we have to shave the head to do that. But then you only get little tiny pinpoint scars. So it's virtually not noticeable even if you shave your head.
And the area that you're pulling from, now, are they going to be bald there now?
No, because again, we're only taking about 15%, so you can't really appreciate that there's a difference with that. And you know, even if you shave it, you can hardly see that there's anything missing from that zone. And if people let their hair grow, obviously the hair is going to cover over any of that, and you won't see it. And the new hair grows in the new site that we take it to. So basically, we're just in the moving business.
Okay, well, that's a great way to look at it.
Yeah.
Now, this patient who we're going to see today, tell me a little bit about him.
So he's a young man who's experienced his hair loss for the last several years. He wanted a permanent solution, likes to keep his hair short, therefore he wanted the FUE technique, which is the way we're talking about it, and he wanted the latest, greatest machinery for doing this, and that's why he sought us with the ARTAS robot system. So this is our patient, who we're working on today, and what we did yesterday, as we explained, was I made incisions of about 2,700 grafts, or follicular units, that we're going to put in through this frontal zone here. And you can see these are the areas. We haven't done anything with his hair here. This is where he's lost his hair and it's thinning through here. We've actually built out the temporal peaks a little bit. And then what I'm going to do is I'm going to turn you just a little bit. And this is the donor zone where we're going to harvest the grafts from. Wow. So we've marked out the areas that we're going to do, and we're going to remove these follicular units with the ARTAS system,
so this
and then move them.
Isn't just placing hair at random areas. This is an art. I mean, this is very designed and sculpted. So how he's actually going to look? Yeah,
I like to call it trichosculpture, where you actually sculpture, tricho meaning hair, and sculpturing to match the facial structures of the patient, along with the aesthetic change that you're trying to create. And we use the technology of the robotics to be able to do this, and ARTAS makes it easy for us to be able to harvest the grafts from here and for me to do my artistry up here.
Unbelievably natural looking, and it's not even done yet, but just seeing the red dots, it looks like.
Yeah, so that's one of the nice things of doing that. You can get an impression of what it's going to look like.
Incredible.
And so we went through this, and he's very happy with the design.
Great. Very interesting. I'm excited to see.
All right, well, let's get started with the harvest. So this is the donor area, and what we do is this tensioner, we put this on in the area that we're going to begin to harvest. And so we stretch the skin a little bit, put this into place. Pre-stretch them, right? And it's important that it's in the right position on the patient. So if it's not exactly the way we want it, we'll reposition it. We want to see that there's good tension here, which we can see, so this area is taut. And what these little things on here, they're called fiduciaries, but what it enables the ARTAS system to do is it reads these, and you'll see that as we move the robot arm into position, it reads this and identifies all the hair follicles in the area, and it enables us to tell the angle at which the hairs exit the scalp, and then we can calculate the precise distance we want in between each of these hairs. So it's a very exciting instrumentation. We'll position the arm, and you can see the laser beams working.
Okay, so what are we looking at?
So what the ARTAS system is doing is it's reading the fiduciaries, or these markings, these little dominoes on the side, so that it can evaluate all of the follicles and follicular units. So you see the little green dots are identifying the units. And then the color, the green, is the next unit we're doing right now. and the purple is the one we're going to do next, so that we can decide we're going to go after that one or we can actually skip it. So we can harvest it or not harvest it. It gives us that opportunity. And then as soon as we do harvest it, it turns to the bluish color.
So we are actually right now watching
real time, watching it harvest.
Punching the hole.
Right.
And getting
so
prepared to
then what
extract.
you do is if you move your attention to this part of the screen, so again, this is a smaller version of exactly what's going on in the big screen, but you can see this is the actual harvest from the graft before. So you can see we want to be at the second line. See how these black lines are? That's determining the depth at which we're going in. And you can see the hair follicle. This is the hair follicle that we just harvested. So it's a magnified version of that.
And right. You can actually see the punch.
You can see, right? You can see that the hair is centered in that hole. And then what this does is this records the number of harvests that we're doing total and within a specific grid. This number here is the average of angle at which the hairs are exiting. So we're looking at matching that. So it's the average angle at which those hairs are exiting. And you can see what we're doing now is actually removing a couple of these follicles. And we'll actually put one on the screen so that you can kind of see. So you can see that hair follicle. So these are the bulbs. And you can see that hair follicle that we just removed. Okay, you can take that. So you can see she'll pull this one out now.
So it's not only about the machine. You actually have to get
you have to remove by hand, but you can see them being removed. Right.
Follicle.
Right. So we remove them gently. So you can see how complicated this would be to do it by hand consistently.
Yeah.
And that's the precision of the ARTAS system that enables us to do this and to do it consistently and get great quality grafts.
What's interesting though is it's not just a completely hands-off technology.
Yeah, some people feel
you guys are both it's not like, I'm going to stay home and I'm going to send the machine to
right.
work today.
And that is a good point to make, because some people hear, I'm going to have the robotics being done, or I'm having the robot do my procedure, that we lock you in a chair and leave the room and, R2-D2 is in there kind of harvesting your head and all that. You can see this is a small part of the procedure, and it is still labor intensive in the sense that there's a lot of people involved. There's decision making. It assists the physician and his team in harvesting the grafts.
So it's basically doing the dirty work. It's doing the punching, but it's not actually doing the physical removing or the sewing back in.
Right, and we don't sew it in, but it's not placing the grafts back in. But it's doing what requires, it's the what you would call the hard manual labor part that is very, very labor intensive to do by hand, and it's really draining on the surgeon to do that, and takes away from the focus on creating the recipient sites and placing the grafts, which ultimately gives us our aesthetic result.
Right.
But the result is only as good as the materials that you put into the head. So you have to get the best possible grafts. And that's what the ARTAS system does. If you choose to do the follicular unit extraction technique over the strip technique, this is the state-of-the-art way to do it. And it gives us the best possible grafts to get the best possible outcome for our patient. And then what we do is we like to take that extra step, and we'll look at under the microscope to evaluate each graft to make sure it's exactly the dimensions that we want. And with the new system, they really come out great, as you see, but we're extra careful with every step of the procedure. But then what we'll do is we will place these grafts one at a time into the incision sites that we made earlier.
Okay, so there's no sewing, it's simply placing.
No, right. The instrument that we use enables us to just gently place that graft in there, and the sites are so small that they just close up right around it. So you don't see any scarring on the top of the head. It's kind of like if you donate blood and you get a little needle in your arm and then you see there's no mark there. Well, these needles are 10 times smaller than that.
Wow.
And they're very tiny, precise, but you won't see any markings. And then the hairs will eventually fall out and go through a resting period over the next several weeks when the patient's healing. But over the next 5 to 10 months, they'll see their hair grow out and get a tremendous change.
Well, that was very interesting, and it didn't seem like he was in any pain.
Yeah, that's the beauty of using local anesthesia and a little bit of Valium. But seriously, it really isn't uncomfortable. And a lot of our patients don't even take any of the Valium. But the repetition of the machine is actually hypnotic for a lot of patients, and they fall asleep.
As long as you don't, then we're just fine.
Yeah, it's not good if I fall asleep, and that's why the ladies are there to nudge me. And the advantage of having the computer screen, we can look at the grafts that we're doing real time.
Right.
We can evaluate the graft that we just did, and that way we have good quality control. And for the patient's perspective, all they care about is, hey, am I going to get a great aesthetic result? And that's what this is all about, delivery to the patient.
Unnoticeable results.
Yep.
Thank you so much.
My pleasure.
For Aesthetic TV, I'm Laurel House. Stay tuned and stay beautiful.